it's a bit daunting being in a room with people. So unless I was just doing it as a Zoom meeting with everybody. So great to see everyone. I didn't know what was going to happen with COVID sort of spiking and stuff. It's great to have a crowd here. All the apologies I received for people who couldn't make it, they're in ISO. So glad to see you. Great to be here.
It's
at work.
I know, we made your event really easy because you couldn't actually leave the building to go home without turning up to it, so nice and convenient. So, look, when we start with the origin story, I want to start with the origins of Clarity. I actually think it's really important to sort of get inside a little bit of who is Alan Taylor and, what should we know about you? I know that you grew up just around the corner, and I know that there's some really important things in your life story about your growing up that have impacted you. But can you maybe unpack that for a little bit and tell everybody what they don't know about you?
Today we're going to get personal really quickly, Yep. So, before I head down there, it is going to be sort of a little bit of an opening up tonight and sharing, and that was really the basis of doing Clarity in the first place, was to share the experience and to show that it could be done here. And one of the closest and dearest things to my heart is that team over there of Clarity people who are here, okay? And we're going to unpack all of that for an amazing group, right? So if we delve into my childhood, I'm literally a local. If you head a couple of blocks that way, you'll see a whole bunch of buildings that look a little bit like East Berlin back in the day. Writing buildings, and my earliest memories are in a building called Daniel Solander, which you've got the first rectangle block, and then you've got these two very large blocks. The one on the other side, 1413 180 Pitt Street, Waterloo, which is the two floors from the top on the right, was my earliest memories as a child. And as a child, I thought it was great. There was kids around, and it was fun, not realising exactly what it was. And really, what that made me think was, and just recently I've been reflecting, how was I there? And it really moves back to my grandparents, who immigrants, came over after the war. My grandmother was Maltese, my grandfather was in the English Navy. If you know Malta's history, it's off the coast of Italy, and Italy was on the other side. So Malta didn't fare too well, unfortunately. But my grandmother, strong as anything, at all 4 foot nothing, and after the war, she obviously survived it. Some of her family didn't, including her sister, unfortunately, but moved over here, and they moved over with a little bit of money, and were looking to buy a house, found a Maltese real estate agent, and who decided to take all their money and run. So they were here, no money, and a couple of kids, one of them obviously my mother, the other my auntie. And so they found themselves in another facility, another public housing place, which was called McKell, which was actually, if you go to South Rugby League Field, if you cross the road there and go one block, it's just on your left-hand side before you get to the big three lots in Redfern. And actually, their apartment became famous, I should say infamous. You may recall a politician's daughter, Harriet Graham, and her boyfriend, unfortunately, went and visited an apartment where there was a person who supplied other types of medicine which were illegal, and unfortunately murdered him. And that was actually the actual apartment that my mother grew up in. My grandparents had. That's the apartment in B30. It was the apartment that I had some of the most beautiful times of my life. And they were there in the early 70s, they moved when it was brand new, moved out in sort of the 90s, and so it was obviously a tragic incident, but as I said, I reflect on it with such positive view because I had a beautiful family and very supportive. But my mother grew up in that environment in a quite a resource-restricted sort of family. Obviously, they didn't have any money. So my mother died for a year. Unfortunately, couldn't go on in schooling because girls didn't necessarily go, and certainly girls from Housing Commission didn't go, so she had to leave and do went to something called business school, and they learned how to type and all sorts of things, which is it's a sad situation. My father had the same situation. He had to leave school in year 8 because of some domestic issues in the household, and so he had to leave the family and get a job very young. So that's how we found ourselves there. And given that experience that they had, what they wanted to do was have the opposite for me, myself, and my brother. And we're very interested in things like sciences and those sorts of things that they didn't have access to. So I was given a telescope very early on. I was up on the 14th floor, which is a fantastic spot for a telescope. And obviously visualise the moon for hours and hours and all the planets and the like. I was given a chemistry set. I tested gravity with my father's watch and his wallet. He was very appreciative of that. Collected spiders, and my mother found those under the bed. He was very happy, obviously, there was a whole bottle full of spiders there. But they really inspired and focused on my learning, and then obviously spend a lot of their money on my education.
What I really love about when we were talking about those stories the other day, and you were telling me about the telescope and the spider story, and just how you played and interacted with the kids in a similar sort of environment, all growing up with sort of similar, somewhat challenging economic circumstances. But there was a real foster and a love for curiosity and play and experimentation that really does sort of foster that economic and that kind of spirit to go on. So walk us through a little bit about, what made you, go into the sciences at university, and how did you kind of go on that pathway and on that journey? Because it's quite a leap when you don't have somebody in front of you to follow, My family owned a fruit and veggie shop. No one had finished high school. I would have blindly gone to university, very blindly. Still feel like I'm going blindly through the world in some ways. But, how did you kind of navigate into that pathway and that journey?
Yeah, so I guess when you're growing up on the streets of Redfern, and in a place that has a strong rugby league background, you suddenly learn how to play rugby league. And some of the toughest games of rugby league I've ever played are on Redfern Oval up near where my grandmother was living up in the park there, because there was a whole bunch of kids. There was Aussie kids, there was Indigenous kids, there was, I was all along, right? That's what we grew up with. And I became proud of that later in life, and I knew that what's named for us. So,
and some nice shoes.
Yes, exactly. So, we grew up there, and it wasn't necessarily any levels of racism amongst us. We were all different minorities. So what we did was we played a lot of sport, we hung out together. Rugby league was really the focus here. It still is today, right? The Bunnies, very much the heart and soul of this local environment, strong Indigenous following in that team, which is beautiful, and it makes this area really beautiful. But following that experience, also focused myself, I actually focused a lot on rugby league. I shifted to what you call the other side and played a bit of football for the Roosters, actually, and junior grades, and I played a bit of seniors. As you can see, I'm very tall, very big, and so that meant trying to understand my body a little more. I trained a lot. I tried to gain advantage through that, obviously by training hard, and I really love training. Even today, dealing with stress and those sorts of things, I love to exercise to get it out. That led to trying to understand the body more, physiology, biochemistry, understanding fuel sources, those sorts of things. Kinesiology, not the spiritual kinesiology, but functional anatomy was very important, obviously, and understanding how to train. And there's a lot of science in that. And that's what led me, when I finished playing rugby league, to go, I want to keep doing this. This is really exciting. Understand the body was really exciting for me. So that's when I took a year off after rugby league. I finished at 23 years of age, so I went back to mature age. And I was about 24, 25, did my undergrad in science, in applied science, majored a little bit in exercise physiology, and I loved it. Such an intellectual indulgence. And that led to doing honours. Honours I didn't love, because I'm sure there's some people in this room that know what honours is like. Year and a half's work in about 8 months. And, but I still enjoyed it, and there was opportunity after that. And I had a very good mentor, a guy named Professor Martin Thompson, who said, look, there's, what do you want to do next? And I didn't really know. And he said, well, why don't you do a PhD? And I said, well, time. I did my honours, some of you may know, on North Shore. There was a professorial building, an old one with an annex out the back, which was freezing cold in winter. And now they've got these big, beautiful buildings, right? I've been to North Shore recently. And it wasn't anything like that for me. So the garden was the only flashy building. So I went there, spent 3 years there, and that was obviously an exciting time, but really probably drove the change to where I am today.
So it's really interesting, right? Because you think, oh, garden, and you come on and come to Clarity, but actually there was just a little bit of a U-turn there into investment banking. So, you've gone from science, you've gone from fundamental research, you've gone from looking at these big problems and being desperately curious about them, and then going, what, I really want to go spend some time on the money side of things. Why?
So it makes sense to me. What happened during my PhD was interesting, and I often tell people, if you don't go into that deep hole of despair during a PhD, you've done it completely wrong. So, and halfway through, I had no results. It was terrible. Not that I didn't work hard either, so you work so hard, and it's a very difficult time. And I started to think then, is this what I want to do for the rest of my life? I love the sciences, I love what I do, but I just can't prepare all day, right?
No one wants to prepare.
And
that's like that.
Some people do.
T-shirt, no preparing, no.
Some people do. Some people like it. I'm hyperactive, and to have a hyperactive person still all days. So halfway through, I started to figure out where I wanted to be in what I would call the science continuum. And I was so, in my PhD, I was working on cells. I was so far away, even with biochemistry, molecular biology, everything that I do today, but I was so far away from humans. And that's where my undergrad was. Right? I was human physiology, biochemistry, and the like, and also humans and looking at disease. Whereas my PhD, even though I was looking at disease, was looking at how cells become insulin resistant. And so then I started to map out where all the really cool stuff, what I would call cool stuff, is all on the translational side of science. And I'm not one of those people that beats up one side. I may call one side, typically one side I'm on is the dark side. If you know what, treating kids with cancer with the dark side, I'm happy to be here, right? So, but science needs both sides. We get very strong basic, we need people to do that basic work. The fundamentals of Clarity are all based on basic science, chemistry, and the like. And really, the focus for me was, how do we fund it once we've found something? So there's no funding in Australia, typically. So once you find something that exists, once you patent it, there's no funding from the government at that point in time, or very little. And it fits in usually a company and the like, and you get R&D tax incentives then. The first you got to incorporate, you've got to spend the money first. And so there's a big issue in Australia in trying to, and they say we don't translate well, we don't do that well. I thought, well, you know what, why don't I get down that road and see what it's like? And that's what I spent the next 10 to 15 years in what I call the whole face of investment banking, right at the front of capital raisings, M&A, strategy, advisory. And I was lucky when I made the move, I had an opportunity to work on a myriad of different things, resources, and more broader healthcare. A couple of years into that, I was headhunted to join a group called Intech. And Intech, which was a very small company, it was 4 of us, and basically as an assistant staff and the like, we became known globally as the major player in life sciences, particularly post-GFC, for life sciences companies that have access capital. So we had lots of US companies coming to us, and we're using obviously the ASX as an exchange. Over the whole period of my time at Intech, I think we did, and plus at the time before, I've probably been involved in 10 or 11 IPOs, saw what it was like, learned a lot. I was with some great guys, and we matched our skills. Right? I was the only scientist there, the PhD, obviously the PhD, a couple of lawyers and accountant, and we just bounced off each other really well. It wasn't perfect. We didn't have a perfect relationship. It all flow because there's lots of bad days in investment banking, as there are in science. And it's certainly had a dynamic which works for us. We work around the clock and we understood how each other worked and we lived in each other's pockets for a long time, doing some really good deals.
I really love that you've had that experience. There's a couple of things that I just want to pull out because I love the fact that money is not evil. It's actually an enabler in this sector to actually do the good, right? So if we want to take that basic science and have the human impact, it does need to be an investment of time and talent and capital to get there. And so going in and kind of flipping and going into that space to understand that more, are there any kind of key learnings that you think, for the scientists in the audience who maybe haven't done investment banking, have no idea, like just some key learnings or takeaways that you kind of went, this has made me understand, or a key driver that people just need to understand when they're thinking about that fundraising, that capital raising, that process?
Yeah. So it's hard sometimes to condense that, and when we're looking at startups, and where a lot of people might be today, I sort of break up, and maybe I reflect on Clarity, and then I can share that experience, and I think, if I look at the history of Clarity, and I think there's two distinct periods, and I think a way of describing it is through sort of the age of kids. When you start out in startup world, you have what I term a baby or an infant, right? It's costs you lots of money, makes a lot of noise.
Can't survive on its own.
Can't survive on its own, and it needs a lot of nurturing. And it's new to the world, nobody knows it, and it takes a lot of work, right? And if you consider it that way, if I take Clarity, for instance, and when I first came across it, so I left investment banking in April 2013. I shot out an email and I had a few opportunities that came back. One of them was Clarity. A guy named Tony wrote an email, gave me a call within an hour, and it was Matt Harris's partner at the time, and Matt and Tony were focusing on it. And I set out a couple of companies. I'm going to speak some companies out, those sorts of things. And they had this great setup where they were tech transfer office, looking at all the university IP. So I don't have the patience, I must tell you, to work with a university and get the IP out.
Not many people do.
So it's hard. Hopefully they're getting better, right? I find that difficult. I just want to go, and there's usually a hindrance. And it took a couple of years for me to sort that out, but I don't have the patience to do that. But when I joined, before I joined, I looked at it and said, and presenting it, and they're presenting me the baby, and I'm looking at it going, it's an ugly baby.
I was going to say, you just say your baby's really ugly and I don't want it.
And you know what? At that time, all the babies are ugly, right? I love babies, and it's all the babies are ugly. There's no price, typically. There's no revenue. There's no cash. There's no employees. There's nothing. And so when you're looking at companies, that is an ugly baby. So, and Matt's showing me his ugly baby, going, look how wonderful this baby is. And he was working half a day a week on it, so he wasn't fully committed yet either. So I was sort of like, okay, that's a good baby, but, So anyway, 6 months into it, and we reflected on the baby, and because there was nothing in it at the time, and the focus was a little bit on the diagnostic side. And I touched on this a number of different presentations. Diagnostics are great, but it's not an area that I have experience in. I focus on therapies, and that's my main area. Matt had a dash out of him not to do therapies in Australia. It's too expensive, you can't raise capital, and those sorts of things. So that was an additional challenge I saw as I was becoming those burdens. We agreed on what the baby's trajectory would be, and we would focus on therapies.
So let's describe the baby for those who don't know what Clarity does. What's your mission and what do you actually do now? And then let's keep the Clarity story going because we've got to talk about this baby a bit more. And how did it go from ugly duckling to fledgling teenager?
Yes, we are a teenager which has its own problems. So, what Clarity is, and this is very basic chemistry, we are basically a cage company. And so for the more scientifically iterative chelator, we term, and what it does is hold the metal, and that metal is copper. It is that uninteresting, right? So when you're looking at that very early on, why does that excite you? We couldn't even source copper back then, right? There was very small amounts of copper 64 and no copper 67. That's how ugly the baby was, right? We didn't even have a finished, what we could call a finished product. So that's what it does, and there was some really great work years and years and years ago at ANU by a gentleman called Professor Hans Hodgson, who did some terrific work just for whole copper, because all the other chelators leave copper, right? And that ended up in the hands of a gentleman called Professor Paul Donnelly, who did an incredible job making the cage really stable, easy to use, and bifunctional. When I say bifunctional, it not only holds the metal, we can attach anything from small molecules, peptides, which is our predominant focus, or full antibodies or even parts of antibodies. So we can bind anything to it so that we can target that copper to for instance, a tumour. And that can be really important, both for imaging the tumour. So copper 64 is an outstanding PET imaging agent. And then copper 67, if we get lots of the product on the tumour, we zap the tumour. Everyone knows radiation can kill cancer, right? Marie Curie, dating back to her work very early on, was instrumental in that. And so we can see it hidden, so seeing is believing, its products there, and then we switch to copper 67. And now that's evolved into 3 products in the clinic. Prostate cancer with a product called PSMA, Bombesin is a pan-cancer target, for prostate, breast, and some other areas. And then SARTATE, which is very dear to our hearts, it's something called somatostatin receptor, which is expressed on a myriad of tumors, but importantly in neuroblastoma. So we're running that clinical trial in the US now, dosing kids as we speak. So we've moved from what was very basic science into what is now a full clinical program, which is a very large clinical program for an essence company. Usually there's one product for these sorts of companies. We have 6 because both of them can be every product is diagnostic therapy. And then we have obviously an R&D program, some great people involved there, preparing new products.
So hopefully everybody has a really good understanding of what Platinum is doing. It's pretty cool, right? Actually not just for diagnosing, but treating cancer and the nasty ones, really nasty ones, in a lot of ways. I want to come back to you started talking about, when you joined the company, the focus was on diagnosis versus therapeutics. You've clearly come a very long way from that pretty ugly baby to this lovely teenager. Walk us through, how did you actually sort of take that initial sentiment idea and looking at the ugly baby and go, you know what, we can work with this, we can nurture it. What was that pathway look like? Tell me about the science, tell me about the team, tell me about the challenges. Let's go.
Okay. So I want to reflect on just quickly where we are today, and I had the opportunity to speak to our team today. We're in an incredible spot right now, right? There's $100 million in the bank. Our data is outstanding, and when I reflect on, surely you should get angry again, but I'm just going to reflect on it. I had a call on Monday, right? And which shocked me a little bit, and it was from a mother looking to get her daughter onto our trial. And what I reflected on tonight was a discussion about that she wanted to help us get the products to the patients because she runs a foundation. The daughter's had neuroblastomas since she was 2. Got rid of it, it's come back, she's 13. And she was desperate for her child to get access to it and fast track it. Right? And what I said to our team today, I have never been more pleased with where we are and we can offer a solution at this point in time. Right? And everyone has been a massive contributor to that situation, and it brings absolute happiness to me. And I've never been in a happier state than where Clarity is today, even though we've got a little bit on. It's a little bit busy. So, but I reflect back and looking through this baby period, it was a little bit of a culture shock for me to go from investment banking and full on in that all day in the office at 7 o'clock in the morning and leaving 11 p.m. at night, and moving then into, and I needed time off obviously from that. And, there's two reasons to do it. Was to meet my own kids and spend some time with my own kids. It's important for me. It's silly to be a dad. And so I left for that reason. I left for that pure translation. And so moving straight in, I had the flexibility. Obviously, then a lot of sort of work. It was a situation where once I'm in, there's no way until we either fail and click, and that sometimes happens. But there was no opportunity I saw to fail for any other reason. And so it was once in, you're all in. Right? And I think that's important because at the time, as I said, was going quite and stuff. I dragged people with me in and started to build out that team. There was no cash in the fund. Man trying to raise a couple of $100,000, we had $50,000, and there was obviously expenses and those sorts of things. So there was no employees to spend on this work to do. So I said, let's change the deal because I wasn't going to get paid until I raised money. So I said, okay, let's raise $1 million. And he said, wow, okay, that's good. I said, okay, fine. Put together a presentation. I set the structure. The structure was already shares, not already set. Ordinary shares on issue, and raised $1 million on the back of that. It's a very low capitalisation, a couple of $1 million. And I set about that time, so I put my money in. And went about into my contacts and the like. And we raised just over $1.1 million or so in the space of a few months. And I joined in November, so never started capital raising in November. It's a bad time in Australia. And sort of brain dead from too much sun and alcohol.
And every VC is in the US in January, skiing, so.
Yeah, so, and we did it all here, and we did it all with ordinary shares. And the outcome of that, even to raising the IPO, every deal is done with ordinary shares, just so everyone knows. So we raised, I think it's a total of $150 million Aussie, back of a number of tranches of ordinary shares. And that was, sometimes just better be said, I'm sorry, but this was telling them to go away in a nice way, when sometimes the terms were a little bit too onerous. But I have that confidence, right, in capital raising, and I know a lot of people don't have that. Structuring the deal, raising capital first for your own shareholders and building that out is an incredibly important part of the capital raising. Putting together the story, making sure you have the right board and management presenting it well. We did all of those capital raisings off the back of just presentations. And people really, people were there, right? There's nothing else. And so making sure you're getting the right people to come on board is incredibly critical. But there's a lot of nurturing. This is the baby time. There's a lot of nurturing because you haven't got any momentum. You have to look after the baby and you can't run away. It's a really interesting time, They say, sleep like a baby during those periods of time, sleep like a baby, wake up every 2 hours and say, why am I doing this? It's tough. I'm not going to sit here and tell you it's easy. And I had a background in obviously being able to do that, but this is a much earlier stage. And that I was doing, but the smallest deals I did were $10 million to $100 million, right? This was the first raise was $1 million, the smallest raise I ever did. And that's a big raise, right, for startups. And then that led into a $2 million raise. We brought on Chris Roberts, $4 million, and we really, we're nurturing the baby. It grew a little, we started to get some momentum. I love your honesty in this, and I really love that you tell people it's tough. I think there's a lot of hero worship
of founders and startups in the ecosystem, and we kind of glorify them and say how amazing they are, but it's decades until you sort of see some of the fruits of some of that labour, and it is a hard slog, but clearly one that you're still enjoying the journey on. So tell us about some of the things that you've had to build out. Maybe flip into the, how do you sort of match capital with science and the sort of stage gates that you've had to do and continue to build trust with your investors? This is patient capital here. So walk us through that, and what are the pivotal moments in the science and the team, and moments that have been the highs and moments where there's been maybe the hurdle to jump over.
Yeah, so and now I reflect, as obviously I said I lot, but it's very much we in that early stages was when we raised that capital, we could start to bring people, right? And so, because it was just Matt and I with this ugly baby telling everyone we're pretty, and then we started to bring in other people, and Ayla was always there, for instance, who had to shoot off, unfortunately. She was there from day zero with TM Ventures, and then now the scientist retrained with the cornerstone of our finance. Lisa also to us, who were business people, and we needed someone without a science background to come in and start to coordinate. She's been by my side through all the capital raisings, and learned a little bit on the run early, and was obviously instrumental in the IPO. And we started to build out. Ellen, I knew from the Garden, came on board, and had a strong science background and moved in. And then we started to develop, obviously, this team environment. Early on, it was about just trying to get the products through preclinical, and we developed a little bit of a services business back then to generate non-dilutive funding, or gross profit. When we looked at other companies' drugs and could show where they went, so it's not hitting the tumour, then it's not working, right? So we collaborated with a group of groups there, and that was a good revenue stream for a while. But really the focus was our own assets, right? We needed to get our assets through. We were fortunate. Our internal came to power, go innovation and commercialisation. We got some grant money to assist us along the way, and you are crawling through, right? This is, as I said, there's no momentum. It's really difficult, right? So we did that for the next few years and build out the company. And then we went through, I think, and I reflect on this period of time now when we're just becoming sort of an early team, right? And I found myself in probably the most difficult situation in the whole time. And that was, we were getting very close as we were looking to bring in a strategic. We were getting very close to running out of money. And too close for me anyway, right? And Clarity has never sacked anybody or cut back our workforce in any way whatsoever since I've been on board. But take that, as this is the part on, never giving up on the baby, right? And we're proud of it. We've grown our team. We're some 25 now. We've never had that situation ever in my time. Obviously, it was tight just before I came on, and and this is what startups usually experience, right? Unfortunately, my team doesn't know what that's like. We've always had a champagne opportunity, obviously, with money that we can get to the next stage, and that is delivering on those next milestones and going out. So we went first capital raising in July, next at 2, next at 350, next at 935 or something, next at 15. I'm looking at Lisa here, I think it's 15, and then the company IPO was up 28. I think so. Everyone's happy on it, right? But we had a situation where I found myself, and I'm very much, saying let's do this, and I found myself alone in a situation where I was trying to raise the capital, and it was drawing out, and I got to a point where I didn't, we had one group at the time, we left the other capital raising there, and that was a very difficult time. And so I buckled down and got that done, which was a $5 million, and then closed out the additional 5 million. But I went through a little bit of a personality clash with me and the company, going, I want to be here, which is where we are, which we got to, which is good. And I said, we've got to have this teenage time, right? So a similar discussion with my daughter, I told my daughter, who's 14 now, this is going to be a difficult period, we're going to clash, but I'm not going to give up on you, right? I love you to death, and I'm not going to give up, but there's going to have to be changes made to get to this next stage. You're going to hate me, and so on a Sunday morning when she's got out of bed at 10 a.m, I'm waking up, she tells me how much she hates me, but it's very good, right? Get out of bed. And Clarity went through that phase. But and this is an area which I don't think I handled well. In the next couple of years, though, because I was in that situation, a lot relied on me doing the capital raisings, I said, we're going to change because no one else is asking for money, right? And when I ask for money, I'll actually do that. So we started a restructure. We changed our board, and our board involved then a little bit of a different structure, a senior executive team of people who I would now take to law, right? I'm a pacifist, by the way. But the team we have is just people who, I love them dearly, and they are there and they support each other. And it's, as I said, it's always hard, but they are people who I love and adore. And suddenly I had a group of people that I could rely on, right? And so we have a number of people in the set, and the other people within our organisation who have been by my side, like Lisa once again, and other people, and just really strong because we've been through it, right? We've been through everything. But that change was probably the hardest. As I said, I probably managed it really badly because I focused on the outcome, which was critical for me, right? We're not failing here, focused on the outcome. And then after a couple of years of that, and all that change was implemented, guess what? We had another capital raising group, right? So, I remember I tripped around the world again and for a couple of weeks with Colin then, and this is actually 2019. So this is when COVID's about to hit, and got back and jet lagged and tired, but happy where the team is. We had good feedback, and but I had a colleague that came back and said, I think Alan hates me and whatnot, and I went, why did that happen? So, and it wasn't someone on the board, it wasn't somebody sitting next to their 15 in the way, and I started to, because you have to go through some introspection, right, during the process, and I started to do that and think, where did this go wrong? And we were at a point where I was going to have to fire people. Myself, I was there to fire everybody in about a month or two's time, right? And so, but what I did then was focus so much on the outcome, I lost the messaging and why we're doing it, and I took a bit of time on that and learned myself because we're growing a team. I'm used to 4 people in the team doing these crazy things, right? And I reflected on myself and I went, well, do you know what? I was wrong, right? I wasn't wrong in the application, and because I knew what we had to get to, but the process, unfortunately, was hard and arduous. And then at that time, I started to refocus and say, right, let's build this, what I think is really exciting and what everyone wants to work on. We want to save people. We want to do that. We want to get our products into commercialisation. We're in a really great market. And then, and let's get this team back together because it's all in the right place now. Everyone's in the right spots. Everyone's focused on the right outcome. It was beautiful. And so then, it's crazy. April, we kick off that $25 million capital raise. Do you remember what happened then? Australia went into lockdown. So I was bringing people from my backyard saying, please invest. And I said to them, look outside, Alan. There's no one there, we're all locked up. So but we closed that out because we had a great team and a great focus. We closed that $25 million out, which made then the $92 million, the IPO. I know people will probably come here to hear about that. It was easy. It was easy because we did that hard work early. We built the right teams and the right products, and we went head on into that. I've done a number of IPOs before. I just pulled in the team that I did IPOs with before. Everyone knew how we worked together, and the IPO was obviously a screaming success once again in lockdown. I did it for, we did an international roadshow from an office up there.
So that's a whirlwind. Thank you for sharing all that. You just shared quite a bit, and I just want to unpack a couple of things. But first, a comment. I'm really glad that you've got a team to go to war with, because the war that you're going against is cancer, so it's definitely the war that will be worth going to fight, I think. So I think you're all doing this proud as Cicada resident family members. We're really incredibly proud of what you're doing and what you're trying to achieve through that. I just want to touch on a couple of things there, because I think for nearly everybody in the audience, it's really rare that we get C-suite executives up here and talking about their own personal leadership journey and their learnings, and it is lonely. It's really lonely when you're sometimes having at that point of looking at payroll and looking at the cash flow and going, oh my God, I've got the most difficult decision in my life. It's really hard about who you turn to. So I just want to kind of take a moment and acknowledge that you've shared that with us tonight and that vulnerability, because I think it reflects a great level of self-learning and understanding of yourself and growth. And I think that's the kind of environment and community that we want to see, that we've had founders or soon-to-be founders in here with a commercialisation course today. And I think you need to know it's a lonely journey, so how do you find a community to support you, and then how do you actually build a team around you? And I think the other thing that was really strikes me is listening to your story about what happens when team breaks. And it's funny, because I reflect back on my years at Google, and I'd say team culture breaks at every 25 people or so, or 20 to 25 people, and every time you add another 25. And I remember having the conversation when I joined here with Alyssa from SpeedX, and they were just at 40, and she's like, everything is breaking. And it is, because you're having to hire in different people and different skill sets, because the kids getting a little unruly and a little older, and maybe need some extra adult supervision for those who are in the room. So it's amazing to hear you tell us about that, but also your own reflections on it, and how you've gone. And I know you speak of the team so all the time. So team, by the way, you don't know, but Alan tells me about you all of the time, and he always speaks about the incredible way that you come together, the strengths that people bring to the table. And I think that's really important. So you kind of skipped ahead to the IPO, and we've got it. And I remember running into you and talking about, yeah, we're working some long hours, but everything's going great. Tell us about that moment last year, which is not that long ago, really. And what's happened since then? Because once you list, there's a whole bunch of other scrutiny that comes along, and it's, blessings and cursings of things a little bit. But what's that been like, and what's it been like for you, and what's it been like for the team and the organisation, and where are you kind of headed, and what's your focus on now?
Okay, so let me touch on the lonely thing first, and because I know a lot of families have that, because I just want to reflect on that for a second, and then we can discuss into that leading into the IPO. I don't like being lonely, and I found myself lonely for one moment in time, because I can't do that. So it's not part of my makeup. I'd rather work as a team. I long rugby league, as I said, it was instilled in me how to play as a team player. And so when I say I in those situations, it's not I, it's an awesome team. And so when there's people within our organisation, as I said, when there's a strategy or we go into a strategic discussion with someone or whatever, we go in as a team. Every meeting is a team. Every meeting is at least 2 people that I go to. Everything we work on, and I tell people never to even say I in emails. And I've said that I've had a few conversations in that, because it alienates the person, right? Because if it goes bad, then they will suffer. And this was instilled in the investment banking, when everyone's looking to point a finger and blame somebody, right? And I never want anyone to be blamed for anything. Right? If there's a blow up, we go on as a team and we sort it out. So as a founder of a young company, I don't know how you do it if you do it by yourself. So I can't even give you advice on it. I think it'd be so stressful and hard, because you need people to bounce off when things are difficult. Because sometimes if stress levels get high, and you never want them to get high, you need someone to reflect on, right? So we took our team, we do take our team to war, as you said, again, when we're addressing cancer, and we took our team to war when it came to an ASX listing. And there was a lot of fights, and there was a lot of positions, there was a lot of negotiations, and every meeting that we went to, we brought the status, in different areas at different times. This is what we do here, this is what we do here, we brought our IP attorneys in here. We had all those things, there's a lot of due diligence. Our clinical, our clinical, it's a lot of work. And as I said, I went through a lot of time, so I knew how to position particular things. People have to do a lot of work. We tried to, protect key people. We tried to keep away from clinical because we needed to continue clinical development. We tried to keep away from preclinical, and obviously had to drag some certain people into that mix at different times. So that we were prepared. I knew what we had to do. We had the team to do it, and they're amazing. And so then we led into that, and I could share the experience with you on preparation. We worked with Jeffries and Bill Potter there, had good contacts into those two organisations at different points. Jeffries did a great job in preparing the prospectus with Lisa, once again, who headed that up for our company. And I'm eternally grateful for that role that she played there. Basically, what we did was get Will in, present, and roll out because of the work of the people around us, right? So that was a terrific experience. When we kicked it off, we were fortunate the timing was right, and those sorts of things. And we did a testing the waters very early on, prospectus writing, did a great job there. And if anyone's got some spare time to read our prospectus, we can make it available to you. I think it's a great write-up on radiopharmaceuticals, something that I was very proud of that our team did, and also obviously the advisors on that. And once again, getting the right advisors on board, the lawyer that led that was someone I've known for 20 years, and we've worked on a whole bunch of IPOs together. We've done it all before, right? And that helps. And so it was just nurturing, our team through that, because not a lot of people have done it internally, but it was a great process, incredibly exciting. We tried to get that down pricing and small amount of raising, which is a nightmare for ASX companies, right? It's so typical for life sciences companies to raise this amount and all that work. We're able to get it right up there. I think the amount of money that came in bids was about close to 200 million. We raised the 92, and obviously that's the money left over from the 25. Hence why we still got $100 million in the bank. And really the difference now is we obviously are subject to global events like war, floods, and things which are totally not related to our company. So our share price fluctuates, but we're in a very strong position. Once again, I don't reflect on it, an amazing team where every week you'll see where we've got other announcements around our clinical trials and our developments, and we've got money to do that. So everyone, once again, is in a very strong position where for life sciences at this point in time.
Yeah, I've got to say, I do get overwhelmed by the emails. I've stopped coming back and saying congratulations to you on the team because the announcements seem to come almost every second day. So apologies, team. I do celebrate and share them. I just have stopped emailing you back. So I kind of want to pivot that a little bit further, because one of the things that's been really amazing to see is not only, the listing and the great work that you're doing and the progression in the clinical trials. I kind of get to know and see that really firsthand and the success that's coming. But it's kind of more than just what you're doing in Clarity for those patients. What else are you sort of thinking about in the future and sort of, legacy and impact and not just Clarity's, but your own, and how are you thinking about that?
Yeah, it's an interesting one because a little bit, I guess, having such Clarity is a red fern based company, right? And so it was born and bred here in this building, and the TM Ventures were just up there where Cancer Aid is now. And then obviously that was spun out of that, and even though it was normal tech, those sorts of things, but really the company has always lived here. And so when you get to I think a certain stage, the reason why I did this in the first place was a couple of reasons, but really to translate slides, because everyone said we can't do it, and so now we have clarity for everybody, right? Sharing how we did it, how we made it happen, and if you can copy, that's great. Because I'm happy to share any parts of information that helps you translate your slides, right? The Brentford is a really special place, right? And as I mentioned before, it has a strong Indigenous background and the like, and given my background, there are some people who come from under-resourced backgrounds. And so what we looked to do back was think about, as a tech company, biotech company, is there something else we can do to our local areas? So not only for our own teams to better understand our local environments, but maybe even lead the way for other groups to do it, to understand what Brentford is all about. And so we looked around for some groups that we could potentially partner with and collaborate with that might fit into who we are and what we do. Not exactly what we do, because what we do is translate science for treat cancer, but keep to the fundamental area of ours and can we help out? So we actually formed a partnership with Story Factory and Kathleen, who's just there, is a wonderful person. We set up Story Factory many years ago. It was about helping out local kids who might come from those other resource backgrounds. And it teaches them and gives them their voice, and as she so beautifully describes it, teaches them how to write, and gives them a lot of variety so they can do that. And I know from my background, everyone within our organisation has to write a lot. And the preparation of documents, right? And it's an incredibly important skill in all of what we do day to day. And there's a lot of kids that make this element, and particularly in our local area. So we partnered with Kath to bring on an educator in that space, a local Indigenous educator, to help the local kids, but also to really help not just the Indigenous kids, but other kids from that might be very similar to my background, and certainly more my mother, when missing out on an opportunity for a broader education. And I know this reflects to my personality and my background, that Kath was just there and just ticked so many boxes as a group that's made a lot of sense, where we can volunteer locally and help out differently. And so I incorporated into the company and we discussed it. And what do you think about this? Other things we can do, because we're far removed from the science of what many kids when they're treating them, or we're meant to be until someone's mother calls me and brings us to it. But we typically hide behind the science there, so we want to do something locally, and so we've partnered there, and so it's a great partnership with Kath, and some of the work she does. We also partner with other groups, like we're the platform sponsor for Neuroblastoma Australia and the upcoming Run the Cure, because we're so focused on neuroblastoma. But a lot of the work we do in neuroblastomas is in the US, our clinical trials are up there. We're going to look to actually provide our products and special access for free to Aussie kids. But it's hard to run trials because of the small numbers. We're going to try and set up ways for kids to get access to that. And Neuroblastoma Australia is a group that's obviously part of that patient advocate. So he said, there's a wonderful lady there running again, Lucy, who's unfortunately her daughter died too with neuroblastoma, set that up, she's doing it herself, she's doing an amazing job. So I think there's a little more we can do as companies grow, but not certainly not a startup, because you've got that money, right? And you've got the resources, you just got yourself, and it's really hard, you should just focus on yourself. I think there's when you get to a certain size and the like, and there's a bit of extra money around, and it's small amounts that makes such a big difference for these groups, partnering and having another maybe because we always want to be an employer of choice, so we provide flexibility, and we have a very diverse group of people who work with us, and we maybe there's something else, and that's why we look at some other things that are more on the, the social side of clarity. And it's not for everyone. It's probably just more of a thing that we like to do for clarity, because there's a lot of great people there who are wonderful, and we had alignment there, and we just went ahead and did it.
So I love that, and I want to unpack a few things that maybe you realise, maybe you don't, but it actually speaks volumes to both your vision and the values that you've actually talked to us about throughout this story. One around curiosity and empowerment, which is something that your own story of discovery and science with the telescope and the spiders and all the things that you're about to do, tapping into an organisation going forward and restoring that, but tapping into an organisation that is fostering curiosity and imagination and creation. So there's a really interesting tie in there, but even through your own personal journey and going on, from I'm going to play rugby, I don't know that every rugby player will go out and go, I'm going to go do some, study science to figure out how I can get a physical advantage in the sport. There's a natural sort of curiosity and learning sort of pathway there, and I think that value and that attribute, we see it in Clarity and talking about the team and learning from them and actually receiving from them as well as paying it forward into it. It's this full cycle thing, and the reason that I kind of wanted to ask you that and share that with the community here is I think it's a really important one to think about with your products and your services, that the things that you're wanting to build and dream and do is actually the business values can flow through your company, but also through your entire life and how you're thinking about that. And it's never too late or never too early to start on that journey. So final question that I just want to ask you, what are you really excited about in terms of, it could be about science and innovation, it could be around Australia, it could be around Clarity, it could be around the Story Factory. What's something you're really excited about and that you just want to share with us that you think is a hopeful opportunity for us to join in your excitement? You don't like to be lonely, which I also think is why you're doing Story Factory and getting people to do things. Because you don't want to be alone, which is great, by the way.
Yeah, look, I think, and then I think, and I discussed sort of the sort of issues and learning that I had back a few years ago, and part of the problem I had was that I was so singularly focused on that, right? And I find it difficult to change that. And I'm still singularly focused on the outcome. So I am absolutely not consumed with what we do at Clarity. That is the most exciting thing that I can do with my life, right now and in the future. And as I said, it's what we do as a team in running these clinical therapy trials where we can change lives, and it's not just the lives of the patients, the lives of everyone around them, and that is amazing. I get to share that with this team, right? What we also do, and this is what startups have the ability to do that big corporates don't, is that when you bring people into the team, and I touched on it with our team this morning, I shared with them, there's the amazing emotional side that they benefit from, right? And then there has to be a financial component to that as well, right? Because we're about changing people's lives, and why aren't we changing everyone's lives? And it's critical, it has been for a long time, things like options programs and all of our stuff. It's very broad. It's been hard. I had to fight for that. You wouldn't believe it, and it's quite funny how that system's set up. I'll reflect on it for a second. That if you're wealthy and you're a senior management, you can get options. But if you're part of other parts of the organisation, you cannot. And nor you need to know it. And so we've made changes within our organisation to make sure everybody got right to the IPO like it was on the board. And I said to the team now, I'll miss out on the next issue because I'm on the board. In the back of the head, it's important that everyone has the opportunity to benefit, to have their life changed too, if Clarity is a screaming success, everyone is a screaming success. And
it's a success because of those people.
Exactly. And so, and that has always been an important part. So we're not just changing the lives of families and people who are sick, we're changing the lives of the people who are side by side. And sometimes investors get a little bit icky about that. I'm happy to go toe to toe with them and say, you know what, if it's not for them, then you don't have any company. So I'm happy to fight for that. And at the end of that, I hope we are a screaming success. I hope everyone does well. And everyone benefits from it.
Yeah, we've come full circle. It's all about the people. The science could be awesome and cool, but it's the people that bring to difference. So we are going to wrap up that conversation now, but we do have something really important that we want to do. So we never got to celebrate your ASX listing last year because of the lockdown, and so tonight we wanted to do a couple of things. We are going to ring the bell, and I know you want to invite some people to do that at the moment, but we just want to have a little toast and have a little bit of bubbles to celebrate with you. So pop that cork, Renee. And we've got something here, and we've got something for everybody as well, but I'll get you to pour, I think, because otherwise it'll be all over the floor and I'll get in trouble. Although AJ's not here, so I think I won't get in trouble. But we just wanted to.
And look, before we do that, can I say thank you? You know, obviously we celebrated by teams when we did this. We all set out champagne bottles to all of our team and sat on teams and said, hey, let's celebrate. And it just wasn't the same, right? And I want to thank everyone obviously here in the community for coming out. And I keep telling our team how important they are for the community and how important our company is as a reflection of how to do things and what to do and to share that. And I tell them to share that. But I want them to know, we work so hard every single day and not realise that we're incredibly special. Clarity is an incredibly special company.
So, sorry, you keep talking.
And I'm glad we're having obviously today we can actually celebrate this together and celebrate what was an awesome success. And they're the right colours.
So we just wanted to have a moment. But
that's beautiful.
Congratulations. It's incredible. And there's a really important thing to do. We need to ring that bell.
We do. But you know what I'm going to do? I'm going to call up a couple of people. Is that okay?
Yep.
A couple of people have been really, obviously, who've been involved in the company for a long time and obviously important. I can't call up everyone. Look, Lisa Darling, I want you to come up, please. Lisa was instrumental in the IPO and did lots of work and made sure that prospectus is done. She makes me look great every single day in what she does. Mish, please come up. Mish leads our clinical team, and if you've seen our clinical announcements, she's heading up that whole team.
There's a lot of them. Critical announcements. There's a lot. I'm just saying, there's a lot. It's amazing.
And also Alan, please come up. Well, Alan's been involved with the company for a long time now and works non-stop. She works over in pre-clinical, we dragged it into clinical, and done a great job. So,
you're all going to ring that bell. You're going to make it so
and we've also got it's a little bit. Let's get some gender balance. Matt, let's come up here. We need some gender balance. Matt is the original founder of this company, and obviously identified the accumulator. Works as our chief scientific officer. Come up and join, and let's ring that bell.
What a beautiful baby.
This is much better. This is much better than me ringing it in my office by myself. So, yes.
ring it.
Can I have a cake?